age of 21, while I was at university, my therapist, who had made the exception and had an emergency appointment for me because there was a hospitalization, also got me into an emergency appointment with a psychiatrist. And that was the first time I'd ever seen a psychiatrist. That's the first time she ever asked me to see a psychiatrist. And when I went to see the psychiatrist, that was when I was formally diagnosed with bipolar disorder type 1, when I was in college.
I was traveling with a band, and we were out in LA, and just everything there was very overwhelming. I started hearing voices out there, and just turned into a full-blown manic episode. That was in 1985, so I was 21.
I was first diagnosed when I was 21, and I was in college. And so as soon as I was diagnosed, then I took a semester off, and that was kind of my introduction to my diagnosis.
So once I had the formal diagnosis of bipolar disorder type 1, it became much easier to notice things about me. And then I could look back and say, I've been having these symptoms since I was 15 years old. So it became much more about recognizing the symptoms that I had read about in books. So not only was it about reading, but it was also about having a good support system at that time where I was at, to also recognize what I myself couldn't recognize because I was new in the disease. And it takes a lot of introspection to know your symptoms and to know when they're manifesting.
Try to practice mindfulness as much as I can, really monitoring my emotional state and sort of based on past experience, what is likely to happen when I'm feeling agitated or panicky or whatever, and what do I need to do to avoid having a repeat. So I started just taking a closer look at how things in my environment affect my mood. Because I grew up thinking that, it's purely a biological thing, and you'll have to be on medication for the rest of your life, and there's nothing in the outside world that has anything to do with it. And then, finally, my therapist said, there probably are some things that trigger you, and we can talk about those. And that was really the first time that anybody had explicitly said, it's not just all in your head. I can probably make some changes in my life to reduce my exposure to stressful situations as much as I'm able, and also change the way that I respond to stress as well.
In terms of a treatment plan changing, I had to change therapists 18 months ago, right? Just because I wasn't getting along with this particular provider, and the situation became untenable. So I think in that case, what I do is, in that case in particular, I kind of retreated to a non-medical support team, like my family. And I was like, okay, this is kind of where we're at. And we need to move in a different direction. So what do you think? Because I knew what I had to do, I told them, I was like, this is what's going on. There's going to be a gap here where I'm not going to have anybody to talk to. So I'm going to rely on you more. And I was kind of freaking out because when you don't have a therapist, it's kind of weird. So yeah, I like relied more on them, and then I went back to my psychiatrist and I was like, can you recommend somebody? Because that's something that I found incredibly helpful too, is just like getting recommendations from somebody who is working for you, like working off of their network almost always has led to a high success rate. And I also think that it's helpful that like when you're changing a treatment plan, you don't just, like one of my things is that like I'm always very like quick to accept something as the answer. So I kind of have to pause a minute and just kind of like, it's kind of like when you meet a new person that you're introducing to your world of treatment, it's kind of like going on a bunch of first dates, you know? You don't say I love you to, you know, the person that you're sitting across the bar from, you know, on your first date. You gotta like see a couple people and then call a couple people back, and then as you kind of like go through it and triage, you kind of like find the one, you know, or who you think the one is. But so that's kind of my experience.
I met a wonderful team of psychiatrists there who listened to me and who respected me and who wanted to have a conversation about, well, why didn't you stay on that medication? And I've been on that medication ever since. I've never once left that medication after the hospitalization. My new psychiatrist, we have conversations about, is this medicine working for you? What are the side effects? Recently, when I had a negative experience with the bipolar disorder, when I had more of a manic episode, she was very much, okay, we need to tackle this outside of just the medication realm. We need to talk about, what are you eating? How are you exercising? Are you getting out to see your friends? She really looked at it from more of a holistic perspective. And she's incredible when she listens, like she listens to me so much. So I called her the other day and I told her I was having a negative experience with the medication. It was making me dizzy. And she right away said, you know what, come in this week. You can stop it if you need to, but we'll talk about it. Maybe this isn't the right medication for you. And it was an experience I haven't had before with a psychiatrist, which makes me sad. I was 21 when I was diagnosed. I'm 28 now. That's 7 years. And this is the first time a psychiatrist has actually listened to me. And it means a lot. I am very loyal to my psychiatrist now. If she asks me to do something, I do it. And I feel comfortable telling her that maybe this isn't the right medication for me. She's open to having conversations about medication. And she's also open to saying, medication is part of our conversation. She helped me find a dietitian. We found a personal trainer for me to see on a regular basis. She's communicating with my internalist, with my therapist. My OBGYN and her will be working together when I go back in for my annual visit and I sign the ROI. She's very open to working as a team. I've become very comfortable just bringing it up. It's a part of my family history, just like breast cancer is a part of my family history. I say it on every forum. I'm very clear that like I have bipolar disorder. I take medications to manage that. And some of these medications do need to be taken into consideration when we're talking about my health concerns moving forward. And I have not experienced any rejection of that by the doctors that I have stuck with. There are some doctors who might brush over it, but I don't stay with them. If you're not going to address a health concern that I have, then you're not the doctor for me.
You know, when I go in for my checkup, they at least ask about it, which is something that never happened when I was growing up, at least. I don't think it was part of general practitioners' training to talk about it. So yeah, it does come up, and you know, I had to go to the hospital once for back pain, and even they asked me, like, you know, how's your mental health right now? I was like, wow, thank you for asking.
When I do go and get a physical, which I will, but yes, I do. When it comes to like my primary care physician, you know, obviously they know what I'm prescribed, and so yeah, a lot of the stuff that they help me with is kind of like explaining how certain behaviors can expose you and render certain medications ineffective. Also just kind of checking up on your physical health, like, hey, you know, your blood pressure's high, so you need to exercise more, and then then they kind of say, and plus it'll help you out with this other stuff. So yeah, I think that's important, is just making sure that all the everybody on your team is conversant and there's not any incomplete information. You know, that's, I think, has been a crucial element to my treatment.
I am Cassie before I am a person living with the diagnosis. I am still who I am. It would take me several years to get over this bipolar disorder, and I need to tell everyone that I had bipolar disorder. I would say it took me like 5 years when I was well into my last semester of graduate school in social work to realize that, yes, I have bipolar disorder, but there's a lot more about me. I think in particular it was because all my social work friends would just come to me with all their questions about bipolar disorder, and I didn't know. I didn't know why their client was doing this thing. Maybe they had trauma in their past. I don't know. And that's when I realized that I can't own bipolar disorder. Everyone has their own experiences. It's all unique to them. So it took me quite a while to move past all I was my diagnosis.
One way that helped actually was I used to talk about it when I did stand-up. So I would have I had a whole routine about it. And then that was kind of helpful because, one, hearing me say it to people and then them responding to it, then I was like, okay, this isn't crazy. And then the second reason that helped is that people came up to me after my shows and say, oh yeah, my brother has that, or, you know, I really related to part of this. So it kind of hit them on 2 levels, and then it hit me on 2 levels. And then eventually what happens is I stopped talking about it because I already said my piece and I kind of adjusted to it, and I just didn't want to, because that's not all of who I am, if that makes sense.
It does not define who they are. They are still have all the accomplishments they ever had before the diagnosis. Those still stand, and you will continue to make progress no matter what. The important part is to reach out, and you can reach out to a peer, you can reach out to your friends, you can reach out to doctors, whoever you feel comfortable, because it's very confusing for a while. It's very confusing what that diagnosis means. But we're not limited. We're not less than. None of us are. No matter what our circumstances happen, bipolar or not. I've accomplished everything I wanted to accomplish for my kid. I moved to a big city from a little city. I went to one of the best schools in the state. I went to grad school. I have a master's degree. I'm going to sit for my clinical license exam. I have a very good job at a national office. We're not limited by anything other than what we believe in ourselves.
Just know that there are a lot of people trying to figure this out, and there are a lot of people in your corner.
Everybody has their thing, okay? So you're not alone, and because everybody has their thing, most people are going to give you the benefit of the doubt and get behind you. And, you know, if you're going through hell, just keep going. Just keep moving, you know? Just always keep moving forward.